your tongue almost mirrors your abs. So if your tongue looks flabby, looks too big for your mouth, or ultimately you have all these indents or different things around the sides of your tongue, that's a sign that your tongue is not strong on its own. Hi guys, welcome to another episode of Mind Your Mouth. I'm your host, Melissa Mugno, and welcome to the studio. I'm so excited to do this solo episode for you guys. I feel like I'm in this crazy intimate setting and I get to see all these lights. We're in Miami, which is so fun because we are going to be presenting myself with a group of oral maxillary surgeons, orthodontists, talking about really how much has grown between structure, function, and behavior. I'm constantly humbled when I get to see how far we've come and where we've grown as an industry. And today, I want to talk about something that I think is really up and coming in the myofunctional therapy world. So beauty is everything, right? When I say everything, it's about how somebody really shows up in the world, how confident they feel in themselves. And one of the things I've always spent a lot of time on is being able to read people. When I say that, what do I mean by that? I mean that you can tell so much by the way someone shows up in the world, the way their posture, the way they walk into a room, the way they breathe, honestly, how much their eyebrows move. Trust me, I move my face a lot. I use my hands. So I'm sure if you guys have been watching this and following along, you know how much I use my face. So today, I really wanted to talk to you guys about how I really look at myofunctional therapy and the way we've been evolving myofunctional therapy, especially at the practice. Faceology, I've had the opportunity to really elevate the way I practice. And this weekend, I'm going to be lecturing about it. We did a course, and you guys saw on one of the episodes that we talked about the next level of myofunctional therapy. And I really do believe the next level of myofunctional therapy is all about central nervous system and getting people to feel really comfortable in their skin. Because the way you feel in your body, the way you move, the way you sit up, and the way you stand has so much impact on how you move through the world. The way your voice even talks. I'm even like slightly nervous because I have all the cameras and the light and I feel like I want to do such a good job. I can feel my central nervous system getting a little tight. I actually can feel my voice changing and it's a little dry. So I think we'll have a little sip of water. Why is that? Well, that's because there's a lot of things going on right now. All of a sudden my cortisol is increasing. I'm feeling a little bit like tight in my chest. I can feel my breath because I want it to go really well. I want to do a really good job and I'm naturally putting some stress on myself. So when that happens, you can see it in my body language. What do I mean by that? One of the things that's happening, look, my eyebrows, they'll start to raise a little bit. All of a sudden, I start talking a little bit quicker. So what do I need to do? I need to do one of the things I do in every single session. You know what that is? I do breathing exercises. And I do these breathing exercises where I drop in with the patient and I'll say, okay, how are you doing? How are you guys feeling? What's going on? Because everybody shows up to a session bringing something in, whether they're bringing in something from a bad phone call or a conversation with their ex, or maybe their child spilled something. Or as the child's tired or whoever or whatever they're doing, they're bringing that energy into that space. So it's so important to be able to create a space that feels calm and relaxed. So the way I naturally do that with someone is I'll start to have a conversation and then I use some type of essential oils. One of the things we use in our MyoKit, and if you guys are questioning whether or not you have any myofunctional issues, or you're looking for more of that snatched jawline, or you're trying to biohack and get yourself to optimize your breathing or sleep better, one of the most important tools you should have is essential oils or something called boom boom sticks. So we include these in all of our MyoKits. And what we do is we breathe in the boom boom stick with some type of peppermint or eucalyptus. And we literally will change by taking a deep breath in, and then we literally will take a minute Breathe in, breathe out. And allow myself and the patient to drop into that moment, because I want everyone to be able to move their energy so that then they feel more comfortable being in the space. So as we go through that, we start to breathe in a little bit more. I'll tell the patient, do me a favor, hold your breath on the top, hold it, and then let it out. But when they let it out, I always ask them to do lion's breath. And what I ask them to do is take that breath in and then stick their tongue out of their mouth. There's something so vulnerable about letting your tongue out of your mouth. Do you know in so many cultures, I think it's Tibet, that sticking your tongue out at somebody is actually a sign of endearment. It's funny, it's love. But in a lot of Western countries, we're told a lot to keep our tongues inside. And we're told to don't let your tongue hang out. Think about it as a child. How many times did you hear or do you tell your children, don't stick your tongue out? I know my grandmother told me that. And honestly, what we're doing is we're creating a tightness. We're telling people, swallow more, clench, hold, bring it up, have better aesthetics, look better, be better, which are all important, but you still want to be able to move through it and allow yourself to relax that whole chest, relax the core, and just feel comfortable in that moment. Because then the muscles and the central nervous system feel safer. And when you feel safe, it's crazy the things you can get your body to do. Most of the time, patients just aren't even aware of how much dysfunction or asymmetry they actually are struggling with. And then think about all the things we're trying to do. It brings me back to, I had a lot of patients that would see speech therapists, and I had friends that would see speech therapy and I love speech therapists. But if you have to jump into your speech for 10, 15 minutes in between classes and you're trying to articulate and then you go back and you're not able to truly, really relax in that body, it might be hard for the muscles or the subconscious of your mind to retain that information. So a good myofunctional therapy session will create an environment and an experience that really allows you to feel safe and almost allows you to get comfortable being a little uncomfortable so that we can start to address some of these layers of dysfunction that you have been creating or developing over years, decades, depending on your age. Because we wear so much. We wear our dysfunction. So we're going to talk a little bit about how a lot of people have told me before, they're like, what is she, like psychic? How does she know that stuff? The truth is, I'm just being observant and I'm really using my intuition as my primary tool for how I'm treatment planning and supporting my patients. Because I want to meet you where you're at. I don't want to drag you to where I'm at. So I use some really important tools. I use facial screening, how the face looks, how safe does the face look regulated, how much you interact in your eyebrows, how much do you use those eyes, how much do your nostrils flare, and overall, how much compensations do you have to do in that jaw to be able to get yourself to feel supported so you can do certain movements like sticking your tongue out or clicking your tongue. Clicking your tongue, a lot of people just think it's easy, but there are a large percent of the population that cannot do that. What do I mean by that? Just being able to take your tongue and suctioning it to the roof of your mouth and being able to click without having to use your jaw so much. Because your tongue should be able to be free of your mandible. Your tongue should be able to move and flow without feeling like you have to move your jaw all the time or constantly have to move your head. Because when that happens, that means the tongue itself is weak. I think a lot of you guys can relate to this. When you don't have a strong core, and let me be honest, my midsection has always been my most vulnerable, the area I'm most conscious about because I've always held a lot in my gut. And that's because of a couple things. I think a lot of times I swallowed a lot of my own issues and I would eat it down or I'd eat my feelings. I'm sure a lot of people can relate to that. We all have different habits and different things that we create, mechanisms that we developed to support ourselves. But then on top of it, Scorpios, I'm a November birthday, we're known to hold a lot of fire in our gut. And so I'm always been very nervous and subconscious of it. But when somebody has a weak or low toned ab, what happens? They'll compensate. They'll use their lower back. They'll use their knees. They'll use their hips to do basic tasks like bending over or being able to just kind of maneuver themselves. And then what happens is after a while, things start to wear and tear. You start to get issues in your knees and your hips as you get older. Well, guess what? Your tongue almost mirrors your abs. So if your tongue looks flabby, looks too big for your mouth, or ultimately you have all these indents or different things around the sides of your tongue, that's a sign that your tongue is not strong on its own. It's relying on so much else to be able to support it. So this matters because your tongue is strong. It's like 600, 700 grams of force. It's a dense thing. It's like a bulldozer. And if your tongue can't naturally rise up on the roof of the mouth without a lot of heavy use of the lower jaw, guess what that's going to do? That's going to put a lot of weight and pressure on your shoulders. It's going to put weight and pressure on your neck, and it's going to create people that have really poor posture. My tongue's strong, but I'm still working so hard on my posture. And stay tuned. We're going to have so many great guests coming on talking about the importance of this body because our body does keep score. There's a book about it. The body holds the score. It does. Fascia, muscles, tissues, all of these things have memory. It's a billion-dollar industry on recovery for sports and athletics. We all know some of our favorite athletes have some of the most ideal recovery regimens that are known to mankind, right? They're sleeping in hyperbaric chambers, cold plunging, all this. Why? They're doing this so they can oxygenate and get the most elasticity and keep their bodies primed so that they can continue to do their gifts or allow themselves to continue to push way into their 40s, into their 50s. Just because you're not a professional athlete doesn't mean you shouldn't be taking care of yourself. You matter. Putting your own oxygen mask on first, I can't tell you guys enough how important that is. Every time I fly, which I'm on planes a lot, I constantly hear it. Put your own oxygen mask on first. And I think about that all the time as a parent. Would I put my own oxygen mask on first? I don't know. I can't imagine if something was happening in that moment, would I naturally not want to put it on my children? But then I start to think about it and I start to sit back and I take a breath. And I think in that moment, I would have to be clear, focused, and be able to manage that situation ideally because I need to be there for both of them. So does it make sense for me not to get my own oxygen so I can make sure that my brain is working optimal? No, of course not. I got to put mine on so that I don't make mistakes, so that I make sure I put their oxygen mask on right. So when you're mouth breathing or you're snoring, or you're making audible breathing sounds when you're sleeping, or you're tossing and turning, or you're sweating. All of these things are common, but that doesn't mean they're normal. And it doesn't mean if you don't have multiple layers of these things going on, that it doesn't deserve some attention because you matter. Making sure you are living and you're getting the most out of your day and getting most out of your sleep is going to determine how productive you are, how much you're going to put into that content, how much you're going to put into that personal brand, how much time you're going to be able to multitask, do all the things, be Martha Stewart, be Bethany Frankel, be all the things. Everybody's talking about sleep. It's a billion-dollar industry. It's not only about a pillow or about the way what bed you move or what position. You absolutely can take control of your own body. And the truth is, us as myofunctional therapists, we're just personal trainers that spend way too much time looking at the tongue, lips, and cheeks and paying attention to breathing mechanics, that we can help guide you. We can navigate you through the gym, just like if you were going to any Planet Fitness or any high-end Lifetime Fitness. In my case, I want you to come to a very bougie gym. How many times have you walked into a gym and you've walked around and you have been looking at the material, like all the equipment, and you're like, I don't even know what that equipment is meant to do, but you think you know. And the next thing you're like working out and you're not even sure if you're getting a true exercise. And then you think you worked out, you spent time there, but you didn't actually even isolate and work the muscles that you were supposed to. Or maybe you look silly in the gym, so then you don't go back the next day. Because if you can get a personal trainer to walk you through and show you how to do everything right, you're going to get so much more out of the time that you spend in the gym. And that's what we do. We help connect dots. We help you understand. And I make sure you get the most out of any time you put into your biohacking. So what I like to really go deeper and level to is that it's not just about lips, tongue, and breath. It's about posture. It's about your voice tone. So one of my favorite things that I do in every screening and every consult is I actually make people count. So I make somebody go count 1 to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That should be pretty simple for people. So you should check yourself in the mirror and count that. It comes pretty naturally. Most people aren't surprised or feel like they're being put on the spot being asked to count 1 to 10. But then I ask them to count 70 to 80, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80. This can catch people off guard. And then all of a sudden, they start doing interesting things. Their eyebrows start to raise. Their head starts to move. They start to 71, 72. So they'll raise their speed of their voice off. Just like when I first started the podcast, I was really kind of a little nervous. So I was like a little bit up here. And now as I'm starting to settle in, I get more relaxed. When you can throw somebody off just slightly, you can really start to see how their body reacts when they're in that fight or flight, or when their bodies feel unsafe. You can see what compensations they create. This is really powerful for myofunctional therapists because it allows us to see you in a regulated state and a dysregulated state. So now I know what I'm working with. I know what type of muscles and patterns you're presenting with. And when we do this with children, I'm also watching you parents because you matter. My kids are mirrors of me, whether I like it or not. And they're their own people, but they will repeat and they will do things that are like me. And then they'll start to pick up good things and bad things. So I'm always trying to assess the situation and really look at who's showing up. And when I can watch that, it's so amazing, especially with females and males. One of the interesting things I've noticed about face contouring and facial hair. So men that love beards, that have a lot of facial hair, this usually means they have a weak jaw. There's not many men that I know that have a lot of facial hair that when I look in their mouths or when I watch their posture, that I can't find what we call low tongue posture, some compensation patterns, soft palate issues, meaning where like their little uvula, the punching bag in the back of the throat is actually kind of hanging low, and they're kind of having to work harder to be able to maneuver their tongue position. And the reason they like that facial hair is because the eyes like symmetry. We're natural creatures that are drawn to things that look symmetrical. This is feng shui. This is why we like a room with clean lines. We like things that are symmetry. That's how our brains work, okay? We're primal, and primal things are always trying to find patterns. I think a lot of times we just don't get a moment to be still to really pay attention to it. And I think the more you get to know yourself, you start to realize the patterns you're drawn to or the things that you like. And so if you're a female or a male that constantly wants to change something about their face, which we all have things, don't get me wrong, especially as we age. So if you're a woman and you're contouring high, you want your cheekbones higher, you're noticing that you're doing more things around your lips, right? You're getting lines in here, you're constantly putting concealer under your eyes because you have that heavy dark circle. These are all side effects of something that's going on functionally in your body. Now, I'm not saying that you shouldn't still go get all the cosmetic work. Hey, do you, boo? But maybe also go a little bit deeper. Let's have a chat. Let's look what could have been the contributing factor that created that stuff in the first place. Because your jawline, it's viral everywhere. Mewing, snatch jaws. I don't know. I just Googled a bunch of content creators And if I look them up, it's like these guys are doing tons of things that if your tongue is suctioned up to the palate, you're breathing in real hard, you got this snatched jawline, it makes you more attractive. They're not wrong, without a doubt. Who doesn't want that chiseled look? But ideally, what's happening is that you can't just do that if you have some structural stuff. That's why you need a professional. But I do love the awareness because I think, and I think most 12-step programs would agree with me, you need 3 factors to truly change behaviors. You need good awareness. That's why every 12-step program makes you stand up and say, hi, my name is Melissa Mugno, and I am a clencher, a grinder. I have anxiety. I have what we call UARS. I need to accept the fact and acknowledge and be aware of these dysfunctions before I can start integrating new patterns. And then ideally, we want stabilization. We want to be able to take our new changes and get longevity with that. But if you don't really break away these things and understand it, you're always going to fall slightly short. That doesn't mean it fails. It just means you might have to go back and do it again. When I was in my 20s, I had a breast reduction. And believe it or not, you'd be shocked. I did. They were huge. And they're still big. But I had such body dysmorphia because I was struggling with my lower abs and my gut as well. And I was just afraid that if I had this breast reduction and then all of a sudden I felt as though I needed liposuction because I was going to be disoriented, right? It was going to look too big and too small and all of this perception I had. And so I did it. I had liposuction and I had a breast reduction. I was in my 20s. And it helped. Don't get me wrong. I have no regrets from the breast reduction, but I do regret the liposuction. And here's why. Because the truth is I had a lot of eating and other patterns that I was struggling with, that the truth is what happened was, yes, I didn't gain weight back where the lipo was, but the doctor really didn't explain to me that I was going to gain it now in my midsection. So now, because I didn't change my patterns and my behavior from the way I was eating emotionally or whatever else I was doing, struggling, trying to figure out who I was, that then I was going to get more compensation in a new part. And now in my 40s, after I've had children, I have worked really hard on working through my behaviors. I still have a lot of places I got to go with my eating and my chewing, because even the way you eat, the way you sit down and you have a meal has so much. It can tell you a whole story about yourself. Go eat with someone and really be present with them. I eat fast. That's because I don't even truly know how to sit. I didn't know how to sit and chew and breathe at the same time. So I would swallow, which didn't even allow my receptor to know I was full. Hence why I had a relationship with food. But I also would clench and grind my teeth. So all of these things, not because they all don't have branches and they go deeper, but all of these things were patterns because of some of my bigger dysfunction. Well, my biggest dysfunction is that my jaw is slightly back. My teeth were really, really tight. And I have a small airway, which really affected my sleep. I have a small tongue tie. I have a grade 2 tongue tie, which means that I still have a piece of frenulum that keeps tight. I've worked really hard on stretching it, and I've gotten much better with good therapy, because I could just go do a procedure called a functional frenuloplasty and release it. But the truth is my airway was small, and I didn't just want my tongue to fall back even more. I really worked on all my muscle control, and I've made a lot of difference of getting to know my breathing patterns. I hold my breath sometimes. I would hold my breath when I eat. I talk fast. When I talk fast, I get lightheaded, and then I would overbreathe, and then I would go up in my chest. Well, guess what all that did? That all contributed to my anxiety. We all live in our heads, right? We all have a lot of thoughts. A lot of us believe we are our thoughts. Our thoughts are just thoughts. It's up to us to what we choose to do with them. But the way you breathe, and if you hold your breath, that's like pouring gasoline on somebody who overthinks. So now you're somebody who maybe has a lineage, or you have a pattern or a past of anxiety and depression, and you have breathing mechanic issues. Guess what you just did? You're doubling down. You're going to contribute and create more anxiety and more feeling of that you don't feel safe in your own skin. And yes, I'm telling you guys, we can see all of this in your mouth. And we can help connect all this up. But not only in our mouth, I can see it on your face. I can see it the way you show up. That's why I don't need to see you in person. I can just be with you even on camera. You guys watching, which I'm so grateful if you are, and you're staying through for the podcast, you're seeing me, you're getting to know me, you're watching my body pattern, the way I move, the way I'm sitting. Am I comfortable? Am I not comfortable? I really am more comfortable like this, right? But I'm expressive. I have a lot to say because for a long time, all of those thoughts in my mind, I was trying to get them out of my mouth. But really getting to know my breath and getting to realize why I would clench and grind really allowed me to take control back. And those are the things that we help with, that we really support patients with. So I've talked to you guys about facial patterns. I've talked to you guys about posturing. I've talked to you about paying attention to your legs, your feet, all of these things. The mouth and the tongue are connected to the entire body. Your head is connected to your body. Anybody in the dental world, we don't mean this to be mean, but if it wasn't, we'd love for you to just leave your teeth at the front desk and come back and pick them up later. But fortunately or unfortunately, you have to stay with them. Don't think that your mouth and your teeth or your children's mouth or teeth or crowdedness is only genetic. It's not. It's epigenetic. It's patterns, it's food quality, it's recognition, it's breathing, it's all the things. It doesn't mean you did anything wrong. And it's okay if you just don't know what you don't know. But when you do know, it's a great opportunity to look and allow someone to look with a different lens to see if you can just do more than just fixing something. So what am I alluding at there? I love orthodontics. Orthodontics is what allowed me to be sitting here today because I'm a visual learner. If I didn't start my career as a dental assistant and getting into ortho, I wouldn't have been able to see the patterns. I wouldn't have been able to learn the teeth the way I did. But guys, teeth are idiots. That's what I tell everybody. They're followers. You wouldn't want to hang out with teeth and you wouldn't let your kids hang out with teeth. That's facts because they'll just go where they're forced to go. So if the tongue and the lips, anywhere you can put Botox and fillers are strong, dense muscles and you're using those muscles to swallow, to speak, to have to control when you're moving it, making shapes and sizes with your tongue, then that's going to impact where your teeth sit in your mouth because teeth live in bone. And Anatomy 101 is that muscle always wins over bone every day, all day. So let's talk about something. Can you maintain a bite that was fixed with orthodontics, which is engineering and force, cause and effect, and then not address the muscles that have a massive impact on the stability of those teeth? I think that's pretty self-explanatory. No, it doesn't mean you're going to go back to exactly the way you looked like you did prior, exactly like me talking about liposuction. I don't look like I did before the liposuction. The liposuction changed my lower abs. But the side effect is this. And now I'm working out in the gym, excess skin, 2 children. So now I might structurally have to deal with this. But the side effect of it was that I didn't address behaviors and function about why I originally had the excess weight in my lower abs. And that is the same reason why you have orthodontic issues or relapse. Relapse in the United States of America with orthodontics is a real thing. It's nothing wrong. Ortho is not doing anything wrong. Orthodontists are great. I love all of my dear friends who are orthodontists. But ortho and myo is the best biohack. So adding some therapy into your ortho or myo, if you're thinking about expansion or thinking about some of these things for your kids or yourself, or you're having snoring issues or sleep issues, I promise you, getting a consult with someone like myself or some of my guests that I've brought on can be a game changer. So I just wanted to give you a little bit of an insight of what myofunctional therapy is and what the lens looks like from our end. So if you are struggling with any of the things we've talked about today, get in the show notes, do a self-assessment, Take a look at yourself. Be the best version of yourself. Don't just fix the problem. Don't band-aid something. Do the work. You're worth it. Till next time, guys, this is Mind Your Mouth with Melissa Mugno.